Enema is the introduction of water or some medical fluids, drug fluids, rectally. First of all, we need to define the types of enemas. And there are two common enemas sold commercially. They are the forced enema and oil retention enema. They are used to soften the feces to lead the person to evacuate. These are example of enema. Like here's the fluid and here's the tube to insert the drug. So first we need to define some criteria to initiate the procedure. First of all, we need to realize proper hygiene of hands. We need to provide a clean place after the procedure to the person evacuate in privacy. So we need to check if the bathroom will be available to it. We will need to also provide some blankets, some covers in a not isolated but a private room to the patient to her feel comfortable with the situation. We need to be attentive to some needs of the patient. They could be if the patient have eaten before the procedure, we need to wait at least 1 hour to realize it. If the patient show any signs of any symptoms and they are more dangerous to life, they should be treated before the procedure, and so many others. As nurses, before the procedure, we need to check the patient's chart to confirm the med that will be used in the situation. We need also put the patient in the preferred position according to his situation. They could be not four, they could be 3, and 1 is for self-assessment. They are sitting position, knee chest position, and child position. To initiate the procedure, first of all, we need to lubricate the drug. Then, in case of children, after you remove the blanket, the cover, and prepare the local, we will need to introduce. First, we need to remove the cover of the drug. Introduce in children 1 inch in the rectum. Then we will need to put all the med inside the cavity, the bowl. Then we will need to assist and observe these patients because they need special care because they cannot hold the liquid inside. So we need to waste all this time and observe those patients. In case of adults, we will, with the same med, introduce about 2 inches in the ball. Then we will put all the liquid inside. Then we will need to encourage the patient to hold at least 20 minutes inside. After that, we need to observe the signs of those patients to see if they will show some necessity to evacuate. After the procedure, the patient can cause some mess in the place of work. So we need to be cautious removing our gloves. We need to wash our hands properly. We need also to clean the local that was realized the procedure, and also discard the blankets, covers, and take care of the patient hygiene after it. If the patient requires special attention, we need to accompany him during all the procedure after the evacuation. Cultures, like the patient will not use the tissue for cleaning directly. So it's necessary to use water instead of it. That's why we need to be more cautious. We need to have more caution about habits. We need to be more attentive. So in case of habits, it's super necessary to inform the patient during all the procedure. Like now we will introduce the med. Now we will start the procedure. Now I'm recording your signs, and it's necessary to, after the entire application, we will observe the signs, like if the patient is doing pain face, if the patient swell after the procedure, if the patient will have pain in the local, it's super necessary to observe. Then, if after all these steps the patient does not evacuate it, it's necessary to do a surgical operation in the gastrointestinal tract.